This is Allison. She is presenting with basically fairly classic symptoms of carpal tunnel. She's got the numbness and the tingling, wakes her up at night. She has some trouble with buttons on her clothing, opening up doors and jars. Basically pretty standard complaints. So I'm going to go through my standard carpal tunnel physical exam. So just to be clear, carpal tunnel is a clinical diagnosis. It's made based on patients, based on a combination of physical exam findings as well as the patient's history, which I got from Allison prior to this. So one nice thing about patients with symptoms here, her symptoms are on the right side, is that we have a normal control on the other side, so we can always have something to compare it to. So we're going to compare. I like to do a quick light touch, really a qualitative comparison between the two sides. So I'm going to ask Allison, do these two sides feel the same, or does one side feel different?
The same.
How about these here? Do these sides feel the same or different?
The right feels different.
Okay. And here?
The right feels different as well.
And these two?
The same.
And these two?
The same.
Okay, and that makes sense with a diagnosis of carpal tunnel, because really you're experiencing the numbness on the thumb side of the hand between these three fingers based on the nerve that's involved. Okay, and then next, so once we do that, I'll also compare it to within the hand itself. The hand has two nerves. There's the median nerve covers the digits on the thumb side and the ulnar nerve on the pinky side. So we'll compare these two and say these two feel same or different.
Different.
And these two same or different.
Different.
Which side feels more sleepy?
The pointer finger.
Right. So this is a typical finding in that you compare them to each other. So it's pretty rare that someone would have symptoms on both sides the exact same level. So this is a nice comparison, especially when somebody has carpal tunnel in both hands. Next we do is a test for what they call provocative symptoms. So we're going to irritate the nerve and see if she has any reaction here. So I'll tap over the nerve. This is called a Tunnel sign, and we'll ask to see, do you have any electric shock-like symptoms when I do this?
A little.
And where do they go?
Shooting down the arm.
That they shoot out towards the fingers. And this is also fairly typical with carpal tunnel. I'm going to press here. And some pressure directly over the nerve will also cause some similar symptoms. Do you feel any tingling or buzzing or numbness in your fingertips?
Yes.
Which fingers?
The pointer in the middle.
Okay, very good. So that's pretty standard. And then just to give the patient some rest, I'll have them shake it out. And then you'll do what's called a phalanx test. So we'll have our raise, we'll straighten our hands out, and we'll just let the wrists fall down and keep them in a bent position. And this is a position that puts pressure on the nerve. And similar to why patients get nocturnal symptoms is when they sleep curled up, they often irritate the nerve at night. This is why sleeping with a splint will often help. And after about somewhere between 30 and 60 seconds, most patients with carpal tunnel will start feeling some degree of numbness or tingling in the affected fingers. And is that true?
Yes.
So Allison's getting these
the right
symptoms
hand.
now in the right hand. So then I'll also give them a rest. Now we've really tested the sensory symptoms. We've looked at the provocative testing. The next I want to check is motor function. So we're going to test an isolated muscle innervated only by the median nerve, which is the thumb, the abductor pollicis brevis, or part of the thenar eminence. So I'm going to ask you to elevate your thumb out of the plane of the palm. Very good. And push against me against resistance. Don't let me push you down. Very good. So this is good for Allison, that she's maintained her strength. So she has what I would term to be normal or 5 out of 5 physiologic strength, which is good. So you want to attack these things before they start to develop weakness, because the outcomes are better. And next, and also I'll go through in a full physical exam, I'll check her for any areas of tendonitis which may be causing pain, or symptoms which commonly occur together. So any pain when I press here?
No.
No. Okay. Here?
No.
Here?
No.
Here?
No.
Here?
No.
No. So, which is also good. It is often that patients will experience pain related to tendonitis with carpal tunnel. Then you'll check for other common areas of tendonitis, such as here, which is called dequeromane tenosynovitis, or any other areas of the forearm. Bend your thumb down. Okay, bend your pinning down. Check for strength, which may be related to compression higher up in the forearm. And that basically is my standard exam for carpal tunnel syndrome. I hope you learned a lot. Thank you.